I'm now going to safely administer medication to my patient. Before entering the room, I should check if the scene is safe, free from any spillages, cords, or cables that may pose risk to me, my patient, or the rest of the medical team. Once I can check that the scene is safe, I'm now going to perform proper hand washing in accordance with the 5 moments of hand hygiene. I will do this to prevent cross-contamination before and after touching the patient, before clean or aseptic procedure, after body fluids risk exposure, and after touching the patient's surroundings. I will then take a palmful of product covering all surfaces of my hands, rubbing my hands for 20 to 30 seconds according to WHO guidelines, rubbing my hands palm to palm, back of the hands with fingers interlaced, palm to palm with fingers interlaced, back of the fingers with fingers interlocked, tips of the fingers against my palm and vice versa, both of my thumbs, and wrists. Once my hands are clean and dry, I can now don my gloves one at a time. I can now approach my patient in a kind and professional manner. Hi there, good afternoon. My name is Kadeen and I will be your nurse today. How would you like me to call you?
Oh, you can call me Ash.
Hi there, Ash. That's a very lovely name. Can you hear and see me clearly?
Yes, I can.
Okay, and are you warm enough?
Yes, I'm warm enough.
Is it okay if I draw the curtains to maintain your privacy and preserve your dignity?
Yeah, sure, please do.
Okay, closing the curtains and doing a quick hand rub. Okay, Ash, as for verification of your identity, is it alright if you tell me your name and date of birth, please? I'll be cross-checking it against your wristband. Sorry.
Yeah, sure, that's fine. That's Ash Potter, 1st of January 1950.
Okay. And your hospital number is 0004321. I can confirm that I am with the right patient. Ash, I can see that you're wearing a red wristband. Do you have any allergies to food or medications?
Yes, I'm actually allergic to penicillin and to beta blockers.
Okay, and that's also reflected in your chart. What happens if you ingest these allergens?
Well, for penicillin, I get rashes all over my body. For beta blockers, the doctors told me I've got an anaphylactic reaction to it.
Well, I'm very sorry to hear that, Ash. So rest assured that during your interaction with me, you will not be given with these allergens, and all the information that you've provided to me will be handled in the strictest confidentiality, and only the members of the healthcare team will have access to it. Is that alright, Ash?
Okay, yeah, sure, that's fine.
Okay, Ash. So the very reason I am here, by the way, is to give your due medication. So each medication will have an indication and side effect, but don't you worry, I will be here to monitor you 30 to 60 minutes after the procedure.
Okay.
Alright. Is this a good time for me to do it?
Yes, it is.
And are you happy for me to do it, Ash?
Yeah, sure, that's fine.
Alright. Can I just prepare your medications?
Yeah,
I'll just
sure.
open up my trolley. Alright. I'm now going to check all the details of my prescription. Ash Potter, 1st of the 1st, 1950, 0004321. 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 I can confirm that I am the right prescription chart. Ash, I'm just going to confirm your height and weight. It says here that your height is 1.57 meters and your weight is 74 kilograms. Is that correct?
Yes, those are correct.
Alright, and your body surface area is 1.80 meters squared. And you're under the care of Dr. P, right? Alright. So, Ash, this is very important because your height and weight is used for proper calculation of the medication.
Okay.
Okay. Since it's medication administration, I'll be sure to adhere to the rights of medicine administration, which includes the right patient, the right drug, the right dose, the right date and time, the right route and method, the right diluent if applicable, and rechecking for any allergies. Also, make sure that the prescription is valid, legible, and has the signature of the prescriber. If any of these are missing, I will not proceed with giving the medication and instead escalate it to the prescriber. And if I need any more information about the medication, I'll be sure to check the British National Formulary. Okay. Ash, by the way, do you have any swallowing difficulties?
No, I don't think so.
Okay, and can you swallow your medications one at a time?
Yeah, sure, I can.
Alright, Ash. Would you like it with water or squash?
Water will be just fine.
Okay, I'll take note of that, Ash. Alright, Ash. It's actually good that you're sat upright to prevent any occurrence of aspiration. Okay. Ash, are you in any pain at the moment?
Yes, I do have a pain actually right now.
Okay, I'm very sorry to hear that. Can you locate where the pain is?
Just on my tummy where the incision site is.
Oh, okay. Can you rate your pain from 1 being the lowest pain and 10 being the worst pain?
I'd say about 5 out of 10.
Okay, so that would be classified as moderate pain. Would it be alright, Ash, if we try some deep breathing exercises?
Yeah, sure, we can do that.
Okay,
one.
inhale through your nose and exhale through your mouth with pursed lips. We'll try this one for 2 times. Is that alright?
Yeah, sure, that's fine.
Okay, Ash, inhale and exhale. Inhale once more and exhale. How does that feel for you, Ash?
Yeah, I think it helped with the pain, but can we still check if I've got some painkiller, please?
Oh, that's no problem. I'll check your prescription right now. Okay, so I'm just going to check it very quickly. You were given codeine phosphate at 11 a.m. Okay, that's just 1 hour ago. And lactulose at 11:10 a.m. You don't have any painkillers on your regular medications. I'm going to check your as-needed medications. You have here paracetamol, 1 gram, can be given today with a frequency of 4 to 6 hours, indicated for pain, okay, via the oral route, signed by Dr. P. Wright, 642. Okay. I'm now going to check using my 5 checks. It's due within my time. You're not allergic to it. It has not been given as stat medication as well as in your regular medication. It means it's safe for me to give. Just going to find paracetamol. I have here paracetamol, 500 milligrams per tablet, which will expire on November 2025. Safe for me to give. Since the dose is 1 gram, I'll be dispensing 2 tablets. Okay. Okay. Okay, Ash. Just for verification of your identity, can you confirm to me once more your full name and date of birth, please?
Yeah, sure. That's Ash Potter, 1st of January 1950.
Okay, I can still confirm that I am with the right patient. Ash, I have here your paracetamol. It's indicated for your pain. Some side effects you may feel is nausea or some slight gastric irritation. Okay. Is that alright?
Yeah, sure. That's fine.
Okay, so Ash, have you swallowed the medication?
Yes, I did.
Okay, thank you very much. I'm just going to quickly document that in my chart. Okay, I'm just going to go ahead and go through the pages of your prescription chart. Is that alright?
Yeah, sure. That's
okay,
fine.
thank you very much. Okay, I've already gone through the stat medications. There's no pending stat medications for me to give. Next would be your prescribed oxygen. Currently, there is no oxygen prescribed. How is your breathing at the moment, Ash?
Yeah, I think it's fine. No
okay.
problem with it.
Alright, that's good then. It means there's no indication for me to give oxygen at the moment.
Okay.
Right? You have your first medication, which is your antimicrobial flucloxacillin, 500 milligrams to be given today, plus 7 days equals 8 days, 4 times a day via the oral route. It is actually due within my time. It is also signed by Dr. P. Wright. Okay, so Ash, unfortunately, you are allergic to penicillin. So I'm not able to give this antimicrobial for you, but instead, I will escalate it to the prescriber and probably he can change it.
Okay.
Okay, thank you very much. I'm just going to quickly document that one. And I'm going to put a code of 10 since you are allergic to it. And also sign it at the back portion. And the reason is that you are allergic to penicillin. Okay. Alright, Ash. Okay, so you have here your first regular medication. It's folic acid 5 milligrams to be given today, plus 6 days equals 7 days, once a day. At 12 noon, it's due within my time via the oral route, signed by Dr. P. Wright. Alright, you're not allergic to it. And it has not been given in your stat dose, as well as in your PRN medication. I'm just going to look for the medication in my trolley. Okay. Have your folic acid 5 milligrams, which will expire on December 2023, safe for me to give. I'm going to be dispensing 1 tablet. Alright. Okay, Ash, I have here your folic acid. It is used to treat anemia, and some side effects you may feel would be diarrhea or black tarry stools. Here you go, Ash. Okay, and have you swallowed it?
Yes, I
Okay, thank you very much. I will just quickly sign the documentation. Next is prednisolone, 40 milligrams per tablet to be given today plus 7 days. Unfortunately, the duration is wrong because here it's just stated as 7 days. It's supposed to be equal 8 days. So what I'm going to do is to document it as incorrect prescription. I'm going to look for the code, which is the code of 6. Put the date of the examination and my signature. Okay. Next, your medication is Timolol Maleate eye drops. Unfortunately, it's not due under my time. Okay, so that ends, Ash, our oral medication administration. I'm just going to lock my trolley and keep the keys for safekeeping. Okay. I do not have have any infusions prescribed at the moment. I'm actually done with my medication administration. Do you have any questions for me?
No questions at all.
Okay, Ash, thank you very much. So here's the call bell. Do press it if you need me so I can come to you straight away.
Okay.
All right, I'm just going to recheck my documentation and do my final hand washing and leave the room. Thank you very much, Ash.
Okay.